Good afternoon, everyone. Thank you for taking the time to come to this webinar. Just quickly before we start, a quick housekeeping slide. This session is general information only, and it's not a substitute for your clinical judgment. Please keep your cameras off and your microphones muted during the session. And please put your questions in the chat and we'll answer them all at the end of the session. So welcome everyone to Health Assessments Made Easy, turning reports into patient results. This session is very practical. We're not just talking about billing or reports. We're focusing on how health assessments can lead to meaningful care for patients using existing systems, practice data, and simple quality improvement approaches. I'd like to acknowledge the traditional owners of the land we are meeting on today and pay my respects to elders past and present. I also recognise the ongoing connection Aboriginal and Torres Strait Islander peoples have to land, culture and community, and the importance of self-determination in health and well-being. So this is what we're aiming to cover today. By the end of the session, you should understand what health assessments are for, what Medicare expects, who different assessments apply to, and how to use your practice data to increase uptake. We'll also walk through a simple improvement example using a SMART aim and a small PDSA cycle. And you're not expected to walk away as experts in everything here, but we hope that you feel more confident and know where to start. So with that, I will hand over to the QI team to introduce themselves.
Hi, I'm Chloe and I'm a quality improvement coach for Perth Metro Northwest area. I've been a registered nurse since 2007 and have worked in multiple roles across tertiary systems and primary care. I'm passionate about using quality improvement methodology to assist practices in tailoring their care to their own unique populations, especially looking at ways to target their care to those who require it the most and improve health outcomes for underserved populations.
Hi everyone, I'm Cassie. I'm a quality improvement coach for Perth Metropolitan Southwest. I've been a registered nurse for 10 years and I have experience in primary healthcare as both a practice nurse and a nurse manager. I'm particularly passionate about multidisciplinary care, chronic disease management, and using data to drive improvements and supporting practices to develop meaningful quality improvement initiatives. And I'll hand over to Connie.
Hey, so I'm Connie. I'm a quality improvement coach for Perth Metropolitan South East. I've been a registered nurse for the last 13 years and I've worked as a practice nurse and a nurse manager in general practice, urgent care and women's health clinic settings. In my role as a QI coach, I work to support practices in a variety of ways, including helping general practice staff identify areas for improvement and implement solutions to create positive change. So what is a health assessment? Let's start with the basics. A health assessment is a planned check-in with a purpose, not because a patient is unwell, but to help keep them well. It's our chance to step back and look at the whole person, not just today's reason for visit. We gather key information, medical history, lifestyle, and clinical measures to identify early risks or warning signs. But more importantly, it opens the door to meaningful conversations, helping patients understand their risks, offering practical advice, and putting supports in place early. Ultimately, it helps us shift from reactive care to proactive care, improving long-term health outcomes. So health assessments are a key Medicare initiative targeting patients at higher risk of chronic disease or hospitalisation. At its core, it's about early identification and managing risk in the community before it escalates. A good assessment looks at the whole person, physical health, daily function, mental well-being, and social supports. From a quality improvement perspective, they're a practical tool to support healthy aging, maintain independence, and ensure the right care is in place early. So hopefully this does feel familiar, but let's look at the basics of how to do a health assessment. So before we get into what needs to be included in a health assessment, let's start with where to find them and how to document them. The most common clinical software used in WA is Best Practice, so the examples we'll be showing today are from that system. In Best Practice, there are two common types of health assessment templates. So one is built into the Enhanced Primary Care section, and then there's one that has been imported as Word templates. Whichever template you use, it's important to meet the minimum assessment criteria required for MBS compliance, and then tailor the rest to suit your patient's needs. The inbuilt template is very popular because it's user-friendly. It provides helpful prompts, supports accurate documentation, and includes automatic risk calculations. It can also update appropriate health assessment type based on the patient's age and demographics. Before starting the assessment, patient consent is required. The inbuilt template won't let you save unless you tick the consent obtained box, which is a really helpful prompt. We also recommend transferring key information into the Today's Notes section of the patient file. So in the inbuilt template, this can be done by selecting Save Examination as Today's Notes. And then if you add any recommendations, you can also tick Add Recommendations as Today's Notes. Now, if you're using the imported Word template, you'll need to manually document consent, findings, and any risk assessment scores in the patient notes for the GP to review. Unlike the inbuilt template, this information won't automatically populate clinical fields, so it's important to have a clear team process to ensure that everything is recorded correctly. And depending on your clinical software, it's always worth checking that your templates are up to date. Now, much like quality improvement, health assessment works best when the whole practice team is involved. It really is a team effort, and that includes the patient as well. Now, it often starts with identifying eligible patients using your clinical software and then recalling them to come in. Reception plays a key role in booking the assessments correctly and making sure the right time and item are allocated. Practice nurses are usually central to the process, gathering information, updating history, and completing observations. And then the GP brings it all together, interpreting the information, assessing risk, and planning the follow-up care. And importantly, the patient is an active partner in this. They provide the information, engage in the discussion, and are key to making any lifestyle or behaviour changes moving forward. So when everyone works together, the process is smoother, more efficient, and leads to better patient outcomes. So here's an example of a simple workflow that can help embed health assessments into your practice in a consistent and straightforward way. Now, it doesn't need to be complicated, and the key is having a clear process that your whole team understands. Of course, you can adapt this depending on your practice preferences or the type of health assessment that you're focusing on. So where do we start? So firstly, it's about identifying and booking eligible patients, and Chloe will take you through some practical ways to do that shortly. Next, take a moment to review your health assessment templates to make sure that you're using the most up-to-date versions and that they work well for your team. Now, once the patient's in the clinic, this is where the bulk of the work happens, collecting the assessment information, documenting it clearly in patient notes, and flagging anything important for the GP to review, like abnormal results or key risk factors. This is also a great opportunity to think broader, so checking on preventative care such as immunisations or cancer screening and picking up on any gaps. And finally, don't forget the follow-up, so adding appropriate recalls to ensure the patients don't fall through the cracks and that care continues beyond the health assessment. So now we're going to shift gears a little and talk about Medicare compliance and how we can make sure our documentation and billing aligns with the MBS standards. Now, just to be clear, reviewing Medicare compliance isn't about catching people out or pointing out faults. It's really about taking a step back, reviewing your templates and systems to make sure that they're aligned with the MBS requirements, protecting your practice and making sure that the meaningful work you're already doing is accurately reflected in your documentation. Now, each health assessment has specific eligibility criteria and time frames, so it's really important to double check that you're billing the right item at the right time. So not all health assessments are annual. Some can be done every 9 months, some every 3 years, and then others are a once in a lifetime item. So when you're doing those, it's really important to make the most of that opportunity. It's also worth noting that some item numbers can restrict you from billing another health assessment within the same time frame, so choosing the right item does matter. So the top 7 health assessments on this list here are all time-based billing, which is based on the combined time of both the nurse and the GP. That's why it's important to make the most of this time, especially for assessments that may limit when another health assessment can be billed. It's also worth thinking about this from the patient's perspective. Would they prefer one longer, more comprehensive appointment where everything's addressed at once, or multiple shorter visits that require extra time off work or travel and follow-up? Now, so where do you find all this information about Medicare compliance? So the best place to start is MBS Online, where you'll find information about MBS item numbers and any MBS changes. So you're going to start by typing the MBS billing number into the search bar. The results will display the basic description of the item. The key is to open the extended notes, and you can do this by clicking the links listed at the bottom of the description. This particular item number has multiple listed. So we're looking at note AN036, which discusses all associated billing numbers with time-tiered health assessments, the type of health assessments that can be conducted with these item numbers, the co-claiming restrictions, relevant legislation, frequently asked questions, patient eligibility, and the frequency of service. An additional feature is that they also have linked the explanatory note for each type of health assessment, which will then redirect you to all specific criteria for that particular health assessment. In the example shown there, we've clicked on the diabetes type 2 risk assessment. So even though Medicare health assessments are for different groups, there's a consistent set of things that Medicare expects you to do and document each time. This slide is the quick checklist, so like the foundations. So first, make sure consent is clear, that the patient understands that this is a health assessment and agrees to proceed. It's simple, but it needs to be documented. So next is information collection of history and risk factors. This includes taking a patient history, gathering all relevant information for the overall assessment. Next is the routine measurements that must be taken and recorded. Exactly which measurements can vary by assessment type, but as a minimum, you're capturing the core clinical observation. For some assessments, like the heart health checks and the older person assessment, blood pressure is explicitly required. You're going to conduct any relevant screening assessment, such as physical, psychological, or social. Then you pull it together, compile the overall assessment, identifying what's going on and what risks or issues you've found. You can then implement management plans, interventions, and referrals as indicated, and provide preventative advice and information. In other words, assessment plus action. And finally, documentation. Your notes need to show what you assessed, what you found, and what you planned, because Medicare requirements rely on what's documented in the patient record. So if you nail these foundations consistently, they become routine, making the cohort-specific requirements become an add-on layer rather than starting from scratch each time. Now I'm going to pass over to Cassie, who will take you through the types of health assessments.
Thanks, Connie. So now let's talk about the content of a health assessment and how that changes depending on the type of health assessment you're doing. Because while the foundations are the same, the focus and purpose can look quite different depending on the type of patient in front of you. So as you can see, there are quite a few different health assessments available under Medicare, each designed for a specific population group. While they all share a similar goal of identifying risks and supporting preventative care, the eligibility, content criteria, and frequency do vary between them. Now, it can feel a bit overwhelming when you see them all listed like this, but the key message here is you don't need to memorize every single item, number, or detail. What's most important is being able to recognize which patients may be eligible, choose the most appropriate assessment for that individual, and then using your templates to help guide your conversation for each one. Now, some of you may remember that we've already done a deep dive into the 75 plus health assessment for the older adults webinar. So today, instead of revisiting that, we'll be concentrating on some of the other common health assessments you're likely to use in general practice. For example, the 45 to 49 health assessment, the diabetes risk assessment, the heart health assessment, the menopause and perimenopause health assessment, and the Aboriginal and Torres Strait Islander health assessment. These are all fantastic opportunities to identify risk early, start conversations, and put supports in place. So today is really about building your confidence and recognizing when to use them and what to do next. So first up, we have the 45 to 49 health assessment. This is a preventative assessment aimed at picking up early risk of chronic disease. So rather than waiting until someone is diagnosed, this is about identifying risk early and stepping in before it can progress. It's a valuable opportunity because many people in this age group are generally feeling well and not actively engaging with preventative care or regular general practice visits. So this is often the first real opportunity to look ahead and not just what's happening now. So starting with eligibility, like the name states, it's specifically for 45 to 49 who are at risk of developing chronic disease. And this is based on the clinical judgment of a general practitioner. This assessment can only be done once per patient, so it's critical to utilize the health assessment well. This is also a time-tiered health assessment that Connie spoke about earlier, allowing you to cater the time required for the health assessment depending on the level of screening or planning required for that particular patient. In terms of what to include, this one is really about building a clear picture of chronic disease risk early. You're focusing on things like lifestyle risk factors, biomedical risks like blood pressure, cholesterol, and family history. Essentially, anything that might indicate someone is heading towards a chronic condition. From there, it's about asking, what can we do now to change that? That might be preventive advice, early screening, or simple follow-up and monitoring. And if clinically indicated, you can then also layer more specific risk assessments like the cardiovascular or the diabetes risk assessment. So overall, it's about identifying risks early, taking action before disease develops, which can significantly change a patient's future. And a handy tip for those using a best practice inbuilt template like Connie discussed earlier, once you've entered the information, if you save and then reopen the assessment, it will refresh and highlight any identified risk factors, which can be really useful for guiding the next steps. So let's now talk about the diabetes risk assessment. This one works a little bit differently as it's a two-stage process. It starts with a screening tool and then moves into a more detailed assessment if a risk is identified. This is a structured way of identifying patients who may be at risk of type 2 diabetes, not diagnosing it. And why this matters is diabetes often develops gradually and could go undiagnosed for quite a long time. So this gives you an opportunity to identify risk early and actually delay or prevent onset, rather than just responding once it's already established. So in terms of eligibility, This applies to patients aged 40 to 49 who are at high risk of developing diabetes. The health assessment can be repeated once every 3 years, so once it's completed, it's handy to add a reminder in the patient's file when it's next due. The first step is using the Australian Type 2 Diabetes Risk Assessment tool, often completed by a practice nurse, which looks at things like age, waist circumference, family history, and lifestyle factors. The tool will then calculate the level of risk with a number. If a score was 5 or less, it's a low risk. 6 to 11, it's an intermediate risk, and 12 or more is a high risk. If the patient scores high, then you're able to move into the next stage of the assessment. If the score is low to immediate, great news for the patient, but unfortunately you will be unable to complete the health assessment with them. So for the high-risk patients, it's really about what we do next. The evaluation involves reviewing the contributing factors and building a clear understanding of what's driving it. From there, it's about putting in early interventions to reduce risk. So again, it's not about diagnosing diabetes, it's about preventing or delaying it. Next up is the heart health assessment. This is another important preventative assessment focused around identifying patients' risk of cardiovascular disease. So again, we're not waiting for the event to happen like a heart attack or stroke. We're trying to understand the risks before it happens. So in terms of who it applies to, it's for patients aged 45 and over, or people with diabetes aged 35 and over, or 30 and over for Aboriginal or Torres Strait Islander patients. Cardiovascular disease often develops without obvious symptoms. So again, this is about early detection and prevention. And this gives you an opportunity to support patients in making changes before a major event occurs. As a part of the heart health assessment, a key step is completing a formal cardiovascular risk assessment using the Australian CBD risk calculator. So similar to the diabetes risk assessment, which brings together multiple risk factors into a single 5-year risk score. This includes things like blood pressure, cholesterol ratio, along with whether or not they're on cardiovascular medications. An ECG is not a mandatory requirement. However, if clinically indicated, it can be conducted on the same day. The calculator will then give you an estimated 5-year cardiovascular risk score as a percentage, and this will help guide clinical decision-making and support conversations with the patient about their risk. And this assessment can be claimed once every 12 months. And then we have the new menopause and perimenopause health assessment, which was introduced in July 2025. Now, this is a health assessment a lot of people are happy that it has been introduced, as it has filled a gap in care, because often these conversations were happening in short consults without enough time or structure. So in terms of eligibility, this is for patients experiencing symptoms of menopause or perimenopause, or are already receiving treatment for those symptoms. It needs to be a dedicated consult for at least 20 minutes on this topic. The real value here is the space it creates for more structured and meaningful conversation, because these symptoms can significantly impact quality of life, but aren't always explored properly in routine consultation. So in terms of what to include, like the other assessments, you're starting with gathering history, understanding clinical symptoms, and completing a basic assessment. But importantly, this one goes beyond the clinical measurements. You're exploring how those symptoms impact daily life, sleep, mood, relationships, and work, and what matters most to the patient. And from there, it becomes a shared conversation about management options, investigations needed, and building a tailored plan. And lastly, we have the Aboriginal and Torres Strait Islander Health Assessment, often referred to as a 715. This is a comprehensive, holistic health assessment that looks beyond just clinical factors. So you may already be aware, but if you're not, that as of the 1st of March 2026, the 715 is no longer tied to age-based activity checklists. This means that you now have more flexibility to focus on what actually matters to the patient, rather than working through the rigid structure like we previously did. So this applies to patients who identify as Aboriginal or Torres Strait Islander and can be claimed once every 9 months. Like the other health assessments, this follows the same core overall structure of history taking, but this one places a stronger emphasis on holistic, culturally appropriate care. So alongside physical health, you should also be considering social well-being, emotional well-being, and importantly, cultural well-being. And you are then going to be developing a management plan that reflects the patient as a whole, not just the clinical findings. So now we understand what Medicare requires and the structure of the health assessment. But the real question is, how do we make this time meaningful for the patient? This is where we shift just from meeting requirements to actually creating value. You might recognize the phrase, would you like fries with that? Now, don't worry, this isn't about upselling or turning healthcare into fast food, but it's a helpful way to think about how we use the time we already have here with the patient. In that moment, when someone is standing at the counter, the business is thinking about how to make the interaction more complete without creating extra work later. And it's a great idea that can be implemented into general practice. When the patient is sitting in front of you during a health assessment, you have a very valuable window. They're already there, they're engaged, and you're already having meaningful conversations about their health. So instead of just focusing, what do I need to get through today? Let's shift our thinking slightly to what else would benefit this patient while they're here. The key is we're not adding work for the sake of it. We're trying to be intentional with the time that we already have. Because when we do that well, we save the patient another appointment, we improve continuity of care, and we make the interaction feel more complete and more valuable. So, thinking about screening, this is a really good opportunity to pause and ask, is the patient up to date with their routine preventative care? This might include things like immunizations, cancer screening programs, or other routine health checks. Depending on the patient, it could also include things like mental health screening or screening for chronic conditions that may not have been formally identified yet. Often these can be missed in standard appointments, especially when the focus is on a presenting issue. But during a health assessment, you've got a bit more time and a broader focus, and it becomes a really natural point to check and pick up on anything that might be overdue. So, if during the health assessment you've identified a chronic condition or even early signs of risk, this is a really good point to start thinking about care planning. That might mean introducing things like a GP management plan or a mental health plan. And this doesn't mean that you're going to do it all in that one appointment. It just means starting the conversation and booking them in for a follow-up to do it properly. Because what we don't want is for that risk to be identified and then nothing happens after that. This is about turning that insight into structured ongoing care. Another really valuable conversation to introduce here is advanced care planning. And while it may not feel urgent in the moment, these discussions are often missed unless we create a space for them. A health assessment can be a really natural way to open up that conversation because we're already talking holistically about the patient's health, their future, and what matters to them. And if this is something your practice wants to build confidence in, there are some really great resources our Greater Choices team have created on the Practice Assist website. And finally, thinking about referrals. This is where we can really broaden our approach to care. When we talk about referrals, it's easy to default straight to investigations or follow-up appointments, things like blood tests or imaging. But this is an opportunity to think a bit wider than that. Ask yourself, what could actually improve this patient's day-to-day life? This might include allied health like dietitians, physio, or psychologists, or community support, or services that help independence at home. Because often the things that make the biggest difference to someone's health and well-being aren't purely clinical. They're about how they're functioning day to day and what support they have around them. And this is where we move beyond just identifying managing conditions and really start to look at a whole person. And when we bring everything together we've talked about, screening, care planning, and referrals, this is where a health assessment becomes much more than a checklist. It becomes a really meaningful interaction for the patient. And so with that, I'll hand over to Chloe, who will talk us through how we're going to turn health assessments into a practical quality improvement activity.
Thanks, Cassie. So now you know what a health assessment is and how to find the patients. How do we think about turning a health assessment into a quality improvement activity? We won't be going in depth here about what quality improvement is or covering the basics of documentation. If you do want more depth on QI methodology, our earlier webinar on QI basics is a great resource, which is available on our YouTube channel. Here we're going to run through an example of a health assessment quality improvement activity, which we'll demonstrate by completing a PDSA together. QI does not need to be complicated. First, you need to think about change ideas. A change idea is a specific, actionable, and testable step taken designed to improve a process, service, or system. It's a tangible action you can try out, often on a small scale, to see if it makes a difference. For example, when we're looking to improve health assessment service offerings, could you educate clinical staff on how to do a health assessment to increase their confidence? Or could you create templates for an autofill to improve the ease of completing a health assessment and ensure mandatory MBS indicators are met? Could you contact eligible patients to invite them for a health assessment? These are change ideas you can start right now using your existing systems. So moving on to section 1 of a PDSA, it's the P for plan. What is our goal? On your screen now is an example of a clear, realistic, SMART goal. It uses practice data, has a defined time frame, and spreads tasks across the team rather than just relying on one person. It's specific. We want to increase the number of eligible patients who complete a health assessment by actively recalling them using the Primary Sense Health Assessments Report. It's measurable. We want to achieve a 10% increase in completed health assessments. It's achievable. It uses existing staff, the practice nurse, existing systems, Primary Sense, and current communication methods like phone and SMS reminders. It's relevant. It supports preventative care, improves patient outcomes, and aligns with QI and PIP quality improvement activities. And it's time-bound. We're saying here it's within 3 months of commencing the activity. Section 2 is the do. This is where planning matters. Everybody needs to know their roles and responsibilities, what data you're tracking, and exactly what steps you're taking so the process is reproducible. In the do section, we list out these steps so that our actions are clear to all. Who's involved? The primary lead, the practice nurse, and support reception staff for booking and reminders, and the GP team for awareness and follow-through. How will staff be prepared for the activity? We'll educate all staff on our QI activity goal. We'll educate staff on their roles and responsibilities in the activity. If applicable, we'll educate staff on how to use Primary Sense reports. If applicable, we'll educate staff on how to read and create appointment notes and comments. And if applicable, we'll educate staff on how to use reminders. What data will we collect? We'll be collecting the baseline number of completed health assessments, the number completed monthly during the 3-month period, and the percentage increase from baseline. What will we do? We'll be running the Primary Sense Health Assessments Report to identify eligible patients who are overdue. We'll prioritise patients who attend the practice regularly and who have upcoming appointments. We'll verify Medicare eligibility by checking PRODA or My Health Record for past billing history, ensuring we capture all patients who may have been billed elsewhere. We'll recall patients by phone calls where appropriate and SMS reminders using our existing system, and clear reminder notes or alert. And we'll add clear reminder notes or alerts in the patient file for opportunistic bookings during other appointments and for reception and clinical staff prompts. We'll also be tracking baseline completion numbers before starting. So now that we know what we want to do, let's look at how we can find the patients using Primary Sense and explore some ways for contacting them to invite them for a health assessment. Today, we'll have a look at a demo version of the Primary Sense Health Assessments Report. This report provides lists of patients who may be eligible for proactive preventative care through a health assessment. The report includes 4 tables, enabling practices to easily identify and recall patients aged 40 to 49 who may be eligible, Aboriginal and Torres Strait Islander patients, patients aged 75 and over, and women aged between 35 and 55 who are eligible for the new menopausal or perimenopausal health assessment. The data can be filtered by the columns as seen in the report, such as the ACG score, allowing you to target the most at-risk patients, the last visit, existing appointment, or age. From here, you can look at inviting those eligible patients in for an appointment. The end column also shows when a health assessment was last billed at the practice. And this report can also be exported to a spreadsheet, which can be useful as a recall list. A handy feature a lot of people don't know about is the ability to export patient lists from software such as Primary Sense via CSV file, which can be utilised for easy recalls for health promotional activities. Using these files for patient communication offers a highly efficient and organised way to manage and disseminate important health and promotional information. CSV files, which stand for comma separated value, allow for the easy storage and manipulation of large data sets. This format's particularly useful for healthcare providers as it enables the seamless integration of patient data into various communication platforms, which can then be turned into a list of patients to receive an SMS. Using SMS broadcast for health promotion in your GP clinic can be an effective way to reach your patients with these health information reminders and updates. There are some steps and tips in the links contained here to help you set up and manage an SMS broadcast system that can be utilised for mass communication, can reach a large number of people for health promotion and health assessments, and so many more things. Another good option to easily share information on a patient around the clinic is to utilise your clinical annotation system. These options here are for best practice. If you wish to start contacting the patient as per your recall and reminder policy, add a reminder. If you wish to add a clinical task for a staff member to follow up without contacting the patient, add an action. If you've spoken to or attempted to contact the patient, ensure this is documented in the contact notes. And if you want the message to appear on the day of an appointment, which is a great option for opportunistic contact, if you've identified that a patient is eligible for a health assessment and coming in soon, put it in the appointment notes. By adding into the patient file notes, you can streamline these contact for opportunistic interactions at the practice. And this can start with the first line of contacts for the patients entering the practice, the reception and admin staff. Upon meeting a patient, the receptionist could check if the patient has a file note or reminder saying they're due for a health assessment. They could also then review the patient's age, what they're attending for, could they be eligible for additional services, do the staff have availability to complete these today, and if not, when the next appointment for this service might be, and book the patient in then and there if possible. Moving back to the PDSA, we're up to section 3, the study. This phase is about reflection, not just results. Look at what worked, what didn't, and why. This section is also the reason why we tend to run a PDSA for a predetermined period of time, i.e. this one was 3 months, even though we plan to embed the practice of inviting patients in for health assessments long term. This is where learning happens. You'll also want to identify what worked, what didn't, why, and what we could do better. Finally, we come to the ACT section, which we tend to suggest ends up falling into categories of adopt, adapt, or abandon. These 3 options are all valid outcomes. The aim is to achieve sustainable improvement, not perfection. If we were to say we wanted to adopt it, this might be if we did achieve a 10% increase in health assessments and the process was manageable for the staff. We'd then look to embed this approach into routine practice workflows, continue nurse-led monthly or quarterly recalls using the Primary Sense Health Assessments report, and maintain patient file reminders to support ongoing opportunistic booking. If we're going to say adapt, we might do this if some improvements seen, but the target is not fully met. we might consider adjusting the recall approach, such as focusing on SMSs over phone calls, or we might prioritise specific patient groups. We might refine reminder wording or placement in the patient file to better support reception and clinical staff. Or we might modify frequency or size of recall lists to balance workload. Finally, if we were to, say, abandon, we might do this if there's minimal improvement or the activity places excessive pressure on staff. We'll then say we'll discontinue this recall approach. We might review the barriers and consider alternative strategies to encourage health assessments, such as different recall timing or GP-led opportunistic approach. So we've covered a lot today, so let's have a quick recap. We've learned what a health assessment is and its purpose, how to maintain and check MBS compliance, what are the health assessment target groups. We've thought about adding value to health assessments and how we might do that. We've gone through how to use the Primary Sense Health Assessments report, and we've created a quality improvement activity and drafted a PDSA. But don't worry, you do not have to leave today and think you need to do this alone. The WAFA QI coaches are here to support you with data, planning, testing, and documentation. Similarly, we use the Primary Sense report today. If you don't have access to this or would like to, or have it but would like a demonstration on how to use it, please reach out. Our team of QI coaches work by visiting you and your team at your practice, and this can either be face-to-face or virtual. We can provide support in a variety of ways and be adaptive to your practice and your practice's QI needs. At the practice level, coaches can provide support, resources, and expertise. We can help identify areas for improvement, change ideas, and implement solutions. We can help you use a data-driven approach to effectively drive quality improvement activities. And we can provide assistance in documenting and capturing your QI in your QI register or in a PDSA. So if after today's session you're looking for a little more help or want to be sent the PDSA that we used on screen today, please reach out to us using the details on this slide. And if you've missed any of our previous webinars or would like to share this webinar with your team, all of our recordings are uploaded to the QI playlist on the WAFA YouTube channel. So with that, I'll hand back over to you, Michelle, to go through any questions.
Thank you, Chloe. And now we're going to head into the question section. The first question we have is actually from a previous webinar, which is, can I do a 45 to 49, 40 to 49 diabetes risk and the heart health assessment all on the same patient? And how far apart do they have to be?
So I will answer this one. So as I said on the last webinar, firstly, let's consider what is the benefit to the patient and why are we doing this? And why do they require the 3 health assessments? Do we think that they are at very high risk of doing all 3 things? And what is the value of trying to do them separately? Because the 45 to 49 health assessment is a time-tiered health assessment, and that's for identifying risks of chronic disease. So if indicated, you could do the diabetes risk assessment and heart health assessment at the same time as the 45 to 49 health assessment, because it's a time-tiered health assessment, which means you could claim a longer health assessment number. But technically, say you didn't do the 45 to 49 health assessment first, and you did a diabetes risk assessment first, or when you did the health assessment, there was very little risks identified, and then the patient develops like new habits or lifestyles and new risks. Yes, it would then be reasonable to conduct the other health assessments. The key is to remember that all of these health assessments need to be spaced 12 months apart. I hope that answers the question.
Thank you, Cassie. We've got another one. I don't have Primary Sense. How can I get a list of patients? Would it be PRODA?
I'm happy to answer that. No, it wouldn't be PRODA. Well, first of all, we can always help you get Primary Sense if you do want it. But also it would be either looking through your clinical software or a different data extraction tool if you have one available at your practice. Depending on what software you have, a QI coach can help looking into that and providing you with some assistance in searching through your data. So if you just reach out using the contact details on the email.
Thank you, Chloe. Another one has come through about where can I find up-to-date templates and how do I import them into best practice to use?
Oh, I can answer that one. So you're always welcome to reach out to a WAFA QI coach, or we have the primary care navigators, whoever's in your area, and we can help you with finding assessment templates. There was a couple of questions about the templates there with which ones are in best practice. So there is a few inbuilt into best practice, and then there's also some that aren't. So there's some available online, and also it might mean you might need to create your own within your team that suits your team as well. But if you do need help, please do reach out, and after the webinar, we'll also send out some information with some links that might be useful as well.
Thank you, Connie. We've got a question about what is the recommended time for health assessments for the nurse to complete?
So I will do that one. So it's very dependent on what health assessment you're doing. So a good thing to do is maybe try and practice doing a health assessment and see how long it's taking you to do just the core structure of a 75 health assessment. And then once you get into a routine, once you've done a couple, you realize the time that is required to do that. It is fully dependent on the patient as well. Sometimes you can have a patient that just zims through the health assessment, does the core requirements, you're able to do everything, and you're able to do it in that time frame. And then there's sometimes you get one that's very chatty and will go over time. So it's always good to try and give yourself a good window of how long it would take to do the core components and how to do if it was to run a little bit over time. Normally, when I did a 75 health assessment, it would normally go around 30 to 40 minutes. A 45 to 49 health assessment can sometimes be 20 minutes, but can sometimes be 30 minutes, depending on the risks identified. So definitely just do a couple of practice with your team, how you're using your templates, how long it's taking you to document, and they'll give you a really good guide of how much time to allocate for each health assessment type.
Thank you, Cassie. We have a question about, is it feasible to do GP, CCNP and heart health together?
I can do that one. I believe I will have to check with MBS, but I believe it is indicated to not co-claim on the same day. I believe that those have to be designated appointment times, but you will find that on the explanatory notes of the heart health assessment MBS line. And just really try to read through the co-claiming section to see whether or not you need to reschedule for a different day, or if there's particular guidelines on how you can co-claim them on the same day. So definitely check out MBS online.
I'd just add to that comment that clinically you'd have to think about the value of doing them both together. It may be more beneficial to go into the GP CCNP with the information already there from doing the heart health check, so that you can consider all of the information that you know about that patient in that appointment.
Thank you, Cassie and Chloe. Are there new templates for ATSI assessments?
I'm not aware of any. That's doesn't mean to say that there aren't. I don't know if anybody else is.
Thanks, Chloe. Can you provide patients with forms whilst waiting to fill in, e.g. GDS?
As in a geriatric depression scale? I don't see any reason why not, as long as you're fulfilling that face-to-face time from an NBS point of view. I don't think providing them with a form is in any way contraindicated.
I agree. And in a 75 health assessment inbuilt template, it has it embedded into the health assessment template. So I would assume that it's completely reasonable to do that at the same time as your health assessment. If a part of your process is getting them to fill it in on the paper instead of reading the questions verbally, that's a part of the process of the health assessment.
I would just add to that, obviously you want to make sure that the patient is fully able to understand what they're being asked in the questionnaire. So as long as they were able to, then yeah, but if they need support, then you might want to do that with them.
Thank you. Another question is, where can I get a list of frequently asked questions in health assessments?
I think questions asked by providers, I assume. I'll answer it from that point of view. That would be the explanatory notes on the Medicare item numbers, I imagine. That would have most of the answers to things.
Questions from the nurse.
From the nurse, sorry, do you mean to each other or to the patient?
Would you mind clarifying in the chat, please, the person who asked that question? And then I'll just jump onto another question while you are clarifying. Felicity's asked a question about living in a transient or remote location with travellers and ATSI where someone might have had an assessment done at another location and we check via Proto, but is there a short way of knowing if they are due that might come up in best practice or through a primary sense report? I see that has been answered in the chat, so thank you to everyone who has answered that. Do you want to elaborate on that, or is that one pretty good to go?
Yeah, Sheldon has answered it. The My Health Record, I find, is the quickest way. Proto is very slow, although it is the most correct way. If you go to My Health Record, you are able to look up billing history, and that is the quickest way to search if I've had a 715 recently. It may mean you have to do a little bit of scrolling or Control F to find it in the list of billing items, but I do find that the quickest way to find out. Unfortunately, if I have had it billed somewhere else, that does mean you will be unable to bill it.
Thank you. Okay, so there's some elaboration. Where can I get a list of frequently asked questions in health assessments from the nurse to the patient?
I'd say that would be about making sure you're using a template on your system that makes that you are aware covers everything that you need to ask, that you need to do from an MBS compliance point of view, but also from the point of view of that being a valuable interaction with the patient. If you don't have any in your practice software, email us and I think we've got something. You'll get a copy of the slides with the links and the emails on after this at some point.
Yes, you definitely will. Thank you. Does anyone have any more questions for the QI coaches? If not, we will move on and you will get a feedback form where you can ask any questions as well. The presentation will be available after this session as well as the video. So the slides will be sent through. You'll be able to access the resources on the slides as well. We've got a question from Sheldon. How to best upskill nurses who are new to health assessments?
Sheldon, we're always happy to come out to the practice and have a one-to-one sit down with the nurses about how health assessments can contribute to quality improvement and things like that. This video recording will be available. It may also be a case of within your practice having established procedures and things whereby everyone knows what's expected of them, and there can be some shadowing period of time as well, usually.
There's
Thanks,
also a lot
Molly.
of great resources online. I think the Nurses Chat just put in Practice Central has a great webinar. A lot of websites that are for practice nurses have a lot of great health assessment webinars, but I found the most useful thing was sitting with another practice nurse and just practicing the health assessment, because once you've practiced it, you know what's coming up, you're ready to go. That was the thing that I found the most helpful.
Lizette has asked, what is the best contact for further questions or follow-up? In the presentation slides, you will see the QI email. And if you email that, then you'll get a response from your relevant QI coach. Does anyone want to add on to that?
Just that, no, there's a generic email on there that you can start with, or if you know which region you're going to fall in, because we do all work within different regions, you can email one of us directly as well. Thanks, Cass.
Thanks, Cass, for popping that in. Does anyone else have any further questions? Yeah, so if you email the general QI email, then we can figure out what region in Perth you're from, and then your designated QI coach can reach out to you. Okay. Thank you for the training on PHAs made easy from NRMG. Thank you, Tammy, for putting that in as well. Okay. Thank you, everyone, for your questions. In the interest of time, I will move on. So if you are a nurse and you'd like to capture your CPD, please do so with this Florence QR code here. You'll get an hour of your relevant CPD for you, and I will send out certificates post-webinar so that you can put that in as evidence as well. So thank you for attending the presentation today. That is brought to you by WAFA's Quality Improvement Team, Chloe Morris, Constance Murray, and Cassandra Cott. We really value your feedback as it helps inform our future training. So if you could please scan the QR code, or if you are in a position where you can't scan the QR code, I'll just pop it in the chat. If you could just give us feedback, and this should let you also ask any more questions. I will also send the QR code out after the webinar as well. So if you have any questions you think of later, you'll have it in your inbox as well. So thank you very much, everyone, for attending the webinar today. We hope that you found it valuable, and we look forward to seeing you at our next webinar. So please keep an eye out for the flyers and advertisements around September. It'll be around the 2nd of September, but you'll start seeing the flyers and information far before that. So thank you very much, everyone. We hope you have a wonderful rest of your day. Thank you.